Hi guys, welcome again to this another session of 2 MCQs in 5 minutes. We are into this Tuesday part. Today also will come up with this embryology section. And again, I will just reminding you, we started with the YouTube shorts and on Instagram, the clinical vignettes, the short clinical cases. So have a look at that too. Apart from in the community, we already place a lot of MCQs for you for the quick revision with a small bit of this why this answer is correct. Okay, fine. Let's start the first MCQ of the day. A 20-year-old lady is surprised to discover that she is pregnant. Fine. Following a review of her menstrual history and sexual activity, her physician determines that she is in the fourth week of pregnancy. Fourth week of pregnancy, right? Remember that. Which of the following best describes the condition of the embryo? So basically the question is a typical embryology question. They're asking you if the embryo is in the fourth week of pregnancy, that is post-fertilization, the embryonic life of the embryo is fourth week, right? Not the gestational age. Embryonic life is fourth week. What will be the position of the embryo? So you need to have some basic idea of the general embryology. Let us see the options now, one by one, slowly. Option A says gastrulation is complete. So gastrulation is completed when? In the third week. So I hope it is right. But then they say resulting in 2 germ layers. Gastrulation results in 3 germ layers. Therefore, option A, cross. Option B, the embryo is entering in a period of relative resistance to teratogenic substances. Now do remember the teratogenicity of the embryo is not only in the first 2-3 weeks, but it goes up till the whole first trimester. It goes up till the whole first trimester. Because what happens is that the development of the organs, they mainly occur in the embryonic period, and that embryonic period, it lies up to 8th week. It lies up to the 8th week of gestation, or the 10th week of, you can say, around 8 to 10th week. You can have some idea that around 8 to 8th week of embryonic life. So obviously it will cross the 4th week, and the embryo is not entering into a period of relative resistance. That period of relative resistance will start after 8th, 10th week, or you can broadly say from the second trimester, right? So obviously this is also not correct. Neurulation is nearly complete, third option. Neurulation starts on which week? It starts on week 3. And around the end of the week 3, or we can say around the beginning of the week 4, the neurulation starts to complete. How so? Because the point is that in neurulation we have a neural tube, right? We have a tube known as a neural tube. In this neural tube we have 2 neuropores, and these neuropores start to close on day 25 and day 28. So from 4th week they start to close. So obviously neurulation will be completed, and therefore this is the best possible option till now. Let's see the fourth option as well. Fourth option says that somites have not yet formed. Now somites are formed when? Somites are formed as a result of gastrulation. Gastrulation, the mesoderm will start to form, right? And from mesoderm, the paraxial mesoderm will start to form. And do remember the somites, they start to form on which day? They start to form on day 20. That is at the end of 3rd week they will start to form. So option D is also not correct. Answer is option number C. A very good question of the whole general embryology, combining all the aspects of general embryology. Remember, a very important topic. Let's see the next one. You can see it on the image. Identify that due to the failure of fusion of which processes will a child have this sort of image, having a unilateral cleft upper lip or hair lip. That is the whole question. You want to read it out? Let us read it out too. In this case, the defect is related to the failure of fusion of which craniofacial processes? If you look over here in the face, let me give some findings over here. See, what happens is, if you talk about the development of the upper lip only, right? And do remember in the upper lip, the lateral part of the upper lip, this part of the upper lip, it is mainly coming from where? It is mainly coming from the maxillary process, MAX. While if you talk about the medial part of the upper lip, they're coming from the medial nasal process. So if it is happening on one side, unilateral side, we will say it's a failure of fusion of what? It will be a failure of fusion of the one side maxillary and a one side medial nasal process. They have failed to fuse, resulting in this. That will be the answer, but I will show you in image. Don't worry about this, my rapid discussion over here. This is just for your quick revision, but I'll show you an image. It will be better benefited, you will better benefit from that. Now here the answer will be what? Maxillary medial on option number A. That will be our best possible answer over here. But look at this image and all your confusion will be clear if you have any by now. You can see this different color codings, right? In this different color coding, this red color is maxillary process. This yellow color is medial nasal process and blue color is lateral nasal process. Now, if you look at the upper lip, if you look at the closely at the upper lip area, you only see the yellow and the red colors. As I told you, medial nasal process and maxillary process. And here they forgot to fuse in this area green shaded unilateral cleft upper lip. That will result in this. Quite common. It's quite common, right? So these are two MCQs. We'll meet again tomorrow with some other MCQs of embryology. Till then, bye bye. Take care and all the best. Any doubts, do write in the comment box or do reach our Telegram groups also. The links are provided there in the description of this particular video. In all the videos, we have the description. You can go and watch the Instas or the Telegram, wherever you find. In all these places, mainly the educational content is there and a quick rapid revision. It will obviously benefit you. Very new and interesting concepts are also discussed over there. So that's all from my side. Bye-bye. Take care and see you soon.